Very short. This one's going to be too short as well, but I just wanted to say thank you so much for the wonderful hospitality, just such a warm people. Not just temperature, but just warm. It's colder where I came from. We had a meter of snow. And so I just wanted to thank you for the hospitality and all of you to come and spend the day with us today. So pick our brains while we're here, take advantage. Don't be shy, that's what we're here for. It's my pleasure to present a little bit of a highlight, just 15 minutes, on an overview of the type of research we're hoping to do for World Spine Care. And we're in the process of developing proposals as well, and looking at research funding grant organizations where we can look at getting funding for these. Wrong way, sorry. Took magic hands. Thanks, Scott. Also, we have some underlying principles at World Spine Care about how we want to conduct our research and who we want to conduct our research with. So first of all, you've heard other presenters mention the importance of any of the work we do here, whether it's the clinical services, the investigations, working with community partners, with government partners, and research is no different. It has to be culturally sensitive and appropriate to the local community. And we're finding this is more and more important, and in particular Jeff's experience here and Maria's experience coming will really enforce the importance of us being able to fully understand our communities that we're going to be conducting research with. So that's a very important underlying principle for us. We also know it has to be inclusive. We don't want to undertake any of our research projects without collaboration on the ground from one of your researchers. So we're hoping that one of you in the audience or someone will be able to connect us with and identify people who are interested in being collaborators on our research projects. And with our Ministry of Health meeting, the wonderful woman who spoke this morning told us that she's going to try to identify people that might be interested in participating with us. One of the priorities as well is when you come in and do research in a community and with a community, that you have the ability to mentor and facilitate capacity building, so that when we conduct the research, we're going to be training people how to do research and building local capacity as well. We also need to know that the research is relevant to local healthcare needs. So we need to hear from the community, from the providers, and from the government, what is it important to learn in the work that we're doing. The research has to be unbiased, it has to be ethical, so we'll go through all the proper processes to make sure ethics is considered and patient safety a priority. And we want to make sure the research we're doing is generating new information that supports policy planning and development. So this will help then future population of Botswana. We need input and support from the community, from local providers, and from government. So I'm going to talk briefly about 3 projects that we're involved in. And you've heard reference today to quite a few people talking about the model of care, and Dr. Holdeman is going to go through that a little bit at the end to reinforce the directions that we're trying to take. So project number 1 is looking at the development, of which we're in the process of doing, and with Jeff's input by having the experience on the ground, we're quite a long ways of looking at what our model might look like. But we need to evaluate that model too, and it's an innovative, integrative model of care. It's a lot of words, but it is for the management of chronic musculoskeletal conditions in vulnerable populations. So this is a group of researchers, it's international. They all come with different professional backgrounds and expertise, and they're all very interested in looking at creating a model that we can transfer from different places that we provide our clinics, and make them culturally appropriate in each setting, but also share with the rest of the world, because these models that we create, if they work, can work anywhere, we believe. So this innovative model will look at interprofessional, team-based care that's patient-centered and evidence-based. And while we talk a lot about interprofessional care or multidisciplinary care or interdisciplinary care, the importance is that we actually walk the walk and not just talk the talk. So when we're having a multidisciplinary approach to care, that's fine, but if the physiotherapist, for example, and the orthopedic surgeon haven't actually sat down and had a team meeting and talked with the family physician, it's really not team-based care. So what's really with the model that we're trying to promote is that there's this good communication loop, and so there's a healthcare team around a patient. And they're not just pushed from one person to the other person without a consultative process, filling in the back loop. There's good evidence that interprofessional care is of higher quality, has better clinical outcomes, and higher satisfaction in the workforce who are providing it. So there's all kinds of good reasons to do that. So we're looking at clinical care pathways for screening, assessment, treatment, and management of spine conditions in our World Spine Clinics, conservative care and rehabilitation processes that Jeff spoke about today, and the processes for triaging to specialist care. This is a little bit of a busy slide, a very busy slide, but it was one of the very first kind of drafts where we tried to put together what is it in an algorithm that we're hoping to do. And this is actually going to have to change because some of these lines already, from what we've learned, first being on the ground now for a year and a half, need to change. So it's actually just the way we start to look and plan about how we see this model of care working. The second project is developing and evaluating a frontline healthcare worker training module for screening and assessment in our clinics, so that we will have the ability for frontline healthcare workers to participate in the program that we deliver and also be an aid. So we can have screening initially done and people already starting to be triaged in certain directions. And that'll actually help alleviate the pressures on the primary spine care clinician. And it'll actually build capacity and training and knowledge in local health providers. So we want to create this project. We want to look at knowledge transfer and how effective and how it needs to be applied in this cultural context as well. And there's a great group of people who have already volunteered internationally from different professions to work on this, but we need a Botswana researcher as well. All these projects, we need a Botswana researcher, at least one. So the frontline healthcare training worker module is also looking at supporting the local capacity building and program sustainability. And that's really one of the most important things for what World Spine Care is trying to do, as Dr. Holden mentioned earlier. It needs to be culturally appropriate as everything we do. And we want to look at teaching how to screen initially and then how to start becoming proficient at conducting some preliminary assessments. Their retention and understanding of knowledge needs to be evaluated so that when we're training this frontline healthcare worker to do these skills, we want to make sure that that knowledge is retained. So we will be evaluating our module and getting feedback from participants and evaluating the retention of knowledge over time and updating them. And eventually it has the potential to move towards a train the trainer module. So oftentimes you'll have teams of people come in and train local people to become trainers. So we did a project, and the Bone and Joint Decade did a project in Kenya where we trained a bunch of public health nurses, frontline healthcare workers, and physicians around the proper screening and assessment for musculoskeletal disorders. And we trained 40 people in a 3-day conference, and within 6 months, 259 people in Kenya had been trained through this module. So it has the potential to have a far-reaching impact once we know that the module we've created is the appropriate one. And there is the potential that once we create the module, we know that it works, then we can develop a certification program for it. The third project we're very interested in conducting, and comes from some of our own personal experiences. I did about 10 years of work in HIV/AIDS in Canada, and we saw a lot of our patients who have HIV/AIDS or are on the heart regimens having a lot of musculoskeletal symptoms. We really just don't know enough about what that means, all right? So we have an opportunity here with a population that's higher prevalence than we're seeing in other regions of the world with HIV/AIDS, to look at those people coming in with HIV/AIDS, what are their musculoskeletal conditions? Again, another international group of people interested in doing this study, and we need Botswana researchers to participate. So we're going to try to understand the burden of HIV/AIDS in our clinical population in Shoshone and Malawi, the prevalence of HIV/AIDS in patients presenting to our World Spine Care clinics, the type of conditions that we're finding in people living with HIV/AIDS, and the frequency of those conditions in certain body regions. Are we seeing a lot of wrist pain? Are we seeing a lot of knee pain? Are we seeing a lot of back pain? And if we can get a sense of whether there is actually a relationship to the heart antiretroviral medication therapies and osteoporosis as well, as we mentioned earlier, Dr. Rowe mentioned that was 40 to 65% of people with HIV have osteoporosis, so it's a really enormous problem. We're only this project is focused specifically on HIV/AIDS, but we will be collecting information about other comorbidities in our clinical model and the way we collect data, and that's going to be expanded over time. So what I wanted to say, the most important thing I wanted to say, is that we need to have support from local government to do our research here. We need to have support from other researchers here to do our projects. And we need to work with the community to do this research. We don't want to do research on the community. We want to do research with the community, with providers, and with government and other researchers. So that's